In the midst of all the tragedy surrounding the coronavirus pandemic, there are more hopeful and inspiring moments. I'm George Bodarky, news director of WFUV. That's an NPR affiliate station based in the Bronx. And I'm coming to you as part of a collaboration we have with BronxNet called Bronx Connections. And joining me is Dr. Sulejman Celaj of St. Barnabas Hospital with an amazing story of how COVID-19 reconnected him with an old friend from war-torn Kosovo. Doctor, thank you so much for taking the time.
Thank you for having me. It's a pleasure to be here with you, and I'm happy to share this great story with you and your listeners.
Yeah, so first things first, how are you doing? How are things at the hospital?
Well, it's been a long journey and a tough one. It's really scary and emotional at the same time. It's scary because we know that a lot of healthcare providers are getting sick by contacting with sick patients. And it's very emotional because we see the number of deaths and people that are coming to hospital. It's quite impressive. And I don't think anybody was ready for this or going through different kind of trainings. We're never been trained to deal with something like this.
Yeah, I was going to ask you that question. Has anything in your experience prepared you for a moment like this?
Not really. Before I left my country in Kosovo and came to the United States, the war was about to begin. I did not experience the fighting and the tragedy that happened there. But mentally, I thought I was ready, and because it was about any day to start. And we're lucky with my family, we escaped on time. But I don't think anything can prepare you for this scale. This is unprecedented. The whole world stands still. And we have no prognosis. We just assuming what's going to happen and how things are going to unfold. But we don't have anything close to this to tell us that, oh, the future is going to be this way. One thing I'm sure that the future is never going to be the same, and the norm for normal is going to change.
Of course, throughout this, a lot of healthcare workers have been expressing concern about not having enough protective gear to properly take care of patients. What's been the situation there at St. Barnabas?
Well, initially, St. Barnabas wasn't different from the rest of the country. I think we were so unprepared to the point that me as an immigrant and somebody looking at the United States as this superpower, and we know that it is a superpower, but finding us so unprepared made me feel really so vulnerable, made me feel that we are letting our patients and our co-workers down because we are not ready. And I just compare this with possible warfare and chemical or biological, and probably would have had responded the same. And it's really not the best way to respond to a crisis like this. It's been scary in the beginning. We did not have enough PPE, and but our hospital with a great leadership, they made sure we have it, and now we're doing really great, and we have enough masks, enough gowns, and everything to protect ourselves while caring for our very sick patients. But again, the beginning was a little bit uncertain, that we didn't know how many we're going to need masks, how many ventilators, how many ICU beds. So we were concerned about our own health and life at the same time. We're concerned about our patients, whether we'll be able to deliver the care that they need and they deserve.
But now you're in a better place.
Definitely. Now we're in a much better situation. We're doing really well. We have enough equipment. And I want to share with your listeners the great news that the census in ER is really down to what we see usually. And this is very promising. And it's probably the first day at work that I'm smiling since all this started more than a month ago.
That, doctor, is amazing news. I can only imagine the sense of relief that you're at least feeling at this moment at the hospital, you and your colleagues.
Definitely. It's for everybody. You know, everybody's been affected by this, including the security guards, when you walk up the ramp by emergency department, the maintenance guys, the IT, everybody had to step up. So it's going to be a relief, not only for doctors, nurses, but for everybody. It's really a great thing, and I see a brighter future in coming days.
Well, a lot of people have been stepping up, and they've been stepping up for those on the front lines, the healthcare workers, a lot of generosity, a lot of donations. Talk to us about this great story that you have that reconnected you with an old friend from Kosovo.
Well, a few days after the pandemic started here in New York City as well, I wasn't feeling well. I was having headaches, lasted for few days, and I never had headaches in my life, something like that. And I was feeling lousy. So I spoke to my colleagues in emergency department, and they said, "Oh, probably you should get tested." So I went. We have an outside tent where people are getting tested, so we don't infect everybody in the hospital and protect the hospital. I went there, and somebody took a picture of me. There was a reporter there, and the picture went viral on major networks. And was being shown how healthcare providers are being tested as well. And all of a sudden, I received a phone call from a childhood friend. Her name is Pranvera Bosniaku. We grew up together. We know each other since we were in kindergarten, and through elementary school and high school. And we're in the same class. We graduated same high school, and we all went together in the same prom. And it was. And then, as the situation was getting worse in Yugoslavia, we fled. She came to the United States. I went to Romania initially for my medical school, and we lost touch for about 25 years. Then we reconnected thanks to social media, and we were in touch, and we saw each other once in DC where she lives. But then that night when she saw my picture on CNN, she called me and said, "Hey, are you okay? How you doing? What's going on? Are you sick? Are you positive? What's the test?" And she was very concerned. And I told her, I don't know the results yet, but I'm not feeling good. And she asked me, "Do you have protection? Do you have enough PPEs? Are you guys protected?" I said, "Not really. We don't have as much as we wish we had." So she goes, "Oh, I can make you a mask." I said, "What do you mean?" She said, "Oh, I know how to sew. I used to do that when I was a teenager, and I have an old machine that I'm going to start. I'm going to go and buy materials, and I'll send you masks." So 2 days later, I received a package with full of masks handmade. They're actually very good quality, and this is the one of them. I kept one for myself, and I use it because they're not, they're not N95 and to protect us, but we protect our N95 mask with this homemade mask. So we put it on top, and we can use our mask for longer time. So we received almost 100 of them from her. She stayed up all night and all day, and she kept doing. And I distributed among my colleagues here and shared with everybody. And it was an amazing feeling that a friend, childhood friend that I grew up with now, she's doing something and is protecting to protect me and protect my friends, my coworkers.
Does that feel like having a good luck charm around your neck, doctor?
Of course. It was something really unique and something unexpected. I didn't know that. I knew she's very smart and intelligent and very successful in life, but I didn't know she knows how to do that. But after a few tries, she said she got back into her skills, and she was able to make them for us. And it was a really amazing feeling. And you see that the friends and strangers, they care and they want to help. It's really good.
Yeah, the best, right, comes out quite often in these types of situations. People really pull together.
It's amazing. And then, she needed money also for materials. And now she has developed this whole industry. She has about 30 volunteers that are making masks, and she's getting materials, she's distributing, she's sending to people that they need, and people that she knows and she doesn't know, just sending them to hospitals. And it's a great accomplishment and feeling for her also, because she's helping and she's participating into this global crisis, unprecedented, what I like to call a war against the invisible enemy. And she's doing great. And they have a GoFundMe, also a charity thing that they're running, and they're trying to get some extra money so they can buy more materials and pay for the shipping of the mask.
Let me ask you, doctor, what is your best advice right now for people to protect themselves, to get through this time, to remain healthy?
I think the most important thing is to realize that the vaccine is not close by, is not coming tomorrow, next month, in 6 months. People are working, scientists are working, industries working to develop one. So we have to be very careful. Soon, I think we're going to go back, and the country is going to open up, and we're going back to work and schools, hopefully, and everything is going to go back to what we were used to. Not to call it normal anymore, because it's probably never going to be the same. But people, once they start going back to work, to wear masks, to wear gloves if they can, not throw them on the streets, not throw them where they don't belong, because the streets and the parks are full of masks and gloves, and it's really, really not nice. We don't do that usually, and we should not keep doing it in future. And stay clean, stay healthy, go out there, exercise, stop smoking. Smokers pay a hefty price nowadays. So start becoming healthier and eat healthy, because once you're healthy, you exercise, your immunity is higher, and you'll be able to protect yourself. And by protecting yourself, you protect your parents, your grandparents, your friends. And it's very important.
Well, doctor, thank you so much for taking the time. Thank you for the work that you do there, and thanks to all of the healthcare workers at St. Barnabas.
Thank you also for having me on your radio, and be well and stay healthy.